Well, with the growing number of people losing their jobs and their health insurance, free health clinics all around the country are getting slammed. Millions and millions of Americans are expected to visit one of the nation's free clinics this year. Well, here's the real scary part. Just as the need skyrockets, funding for these free clinics could be on the chopping block. Laura Ingle is here now with the very latest. That is scary, Laura.
Hey, Julie. Well, you know, many people who use these types of services never dreamed that they would be in need of using such services, but there aren't a lot of options out there. And that means that free clinics are having to squeeze a lot of services into tighter operating hours, meaning that everyone is feeling the pinch. It wasn't easy for George Anderson to turn to a free medical clinic after he lost his job and health insurance.
I was embarrassed to take my wife there, but you do what you have to do.
He's not alone.
The patients that we're seeing now are basically the low to moderate income wage earners who have always taken care of their family. You see tears in their eyes when they come in here.
The doctors, nurses, and physician assistants at this clinic in Bridgeport, Connecticut are all volunteers. They provide everything from checkups to lab work, x-rays, and even provide prescription drugs. Clinics serve uninsured low-income patients that live in the area. This year, up to 8 million Americans will visit free clinics across the country. That's up nearly 50% from last year. And while more Americans are turning to these centers for help, funding nationwide has dropped dramatically, approximately 20%.
Free clinics rely on community support. We rely on grants, foundation support, and obviously community donations.
I hate to sound melodramatic, but I think it's the difference between life and death for a lot of our patients.
Just look forward there for a second.
Helen Witowski, who's being treated for high cholesterol, calls the clinic a godsend.
Just the medication alone is saving me $150 a month.
We're saving a lot of money not only for the patients, but we're also saving quite a bit of strain on the system, because if these patients were not treated, they would wind up in emergency rooms.
Well, free clinics, of course, have been around since the 1960s, and medical providers say it remains critical that low-income families have somewhere to turn. Julie.
All right, Laura Ingle, thank you very much.